My name is Alina Tomoyaga, and I am a policy advisor at the European Innovation Council in the Program Manager's Office. And I want to say welcome to all of you to the AIC Advanced Innovation Challenges 2026 Info Day. This instrument, the Advanced Innovation Challenges, is a new instrument that of the European Innovation Council. And today you will learn on how it works, what it aims at to achieve, and how you can take part in this first edition. Before we begin, I would like to go through the housekeeping rules. So next slide, please. Thank you. So today's session is being recorded and web streamed. The recording and presentation will be published on the AIC website in the days following this event. We strongly ask you to pose any question via the Slido, and we will show the QR code just in the next slide. And at the end of our sessions, we will kindly encourage you to fill out a satisfaction survey via a dedicated QR code on which we are welcome your feedback for us to improve even further. Any existing FAQs on the AIC work program 2026 will be updated, and with all the new questions from this session. And if we do not manage to answer to all your questions today, you will be able in the following days to find an answer through our FAQs. Now, I would very kindly want to ask the speakers of this of the info of today info day on advanced innovation challenges to keep their camera on only when the session the respective session is ongoing. And can we go to the next slide, please? Okay, this is the slide. This is the QR code for the Slido where you can post your questions for each and every of the sections. We have 3 sessions today. Advanced Innovation Challenges 2026, a general presentation on what it is, how to apply with it, what are the futures of this new instrument of the AIC. Then we will have a session on the challenge that we entitled Accelerating Physical AI Embodied Intelligence for the Next Frontier of AI-Powered Robotics. And then we will have a session with dedicated questions, QR code for the slide on translating disruptive new approach methodologies into practice. Thank you. Next slide, please. Now, rapidly going through the agenda, we will have an opening by the AIC Program Manager's Office, head of the AIC Program Manager's Office, Anne-Marie Sassen, followed by a presentation by Viorel Pekka, the head of unit of the AIC Transition Unit, which is the unit who will implement the Advanced Innovation Challenges 2026. Then we will have a dedicated session on the Accelerating Physical AI challenge, followed by a session on translating disruptive new approach methodologies and some closing remark at the end of our info day today. Next slide, please. Okay, so now I would very much like to welcome Anne-Marie Sassen and Viorel Pekka to share the most exciting features of this program, this new instrument in the AIC program 2026. So Anne-Marie, to you.
Yes, thank you, Alina. Good afternoon, everybody. I'm happy to present to you today why we have introduced Advanced Innovation Challenges in the EIC work program. And after me, Fiorel will explain all the details on how to apply to these Advanced Innovation Challenges. So if we go to the next slide. So after the Draghi report, where Mr. Draghi recommended a more DARPA-like approach for the EIC, also all other policy documents concerning the EIC during 2025, they have made recommendations for to strengthen the ARPA-style approach to deliver breakthrough mission-driven innovation. So we saw that in the EU Competitiveness Compass in January. Also in June, the EU Startup and Scale-up Strategy mentioned this. It said, encourage the EIC to deepen its ARPA style, challenge-driven programs to accelerate market-creating innovations. And it was also proposed in the Commission proposal for FP10. So there, we can see on the last line that there is a reinforced ARPA approach. The EIC board, they also made a statement on FP10 in October 2025, and they also recommended deepening the ARPA-like approach through more challenge-driven portfolios and enhanced program management. So what does it mean, an ARPA-style approach? If we go to the next slide, please. First of all, in ARPA, there are program managers. So we already have that in the EIC. We already have, since 2021, 10 program managers who are overseeing the projects. But what we didn't have yet in the EIC were instruments like in ARPA, where there is staged funding. So that a number of projects start with a certain challenge, and that then after milestones has been reached, the best projects are selected to continue that research. So that's an instrument that we didn't have yet, and that is now what we try to develop with this Advanced Innovation Challenges. But first, a little bit more about the EIC program managers. So we have 10 program managers in the unit. They are experts in their domain, and they have both the research experience, but also the innovation experience. So they know how to bring research to the market. And on this slide, you can see the 10 program managers that we have and their domains. And today we will see the challenges developed by Orsolja Simmons and Federica Sanka, who are the 2 program managers for health. So they developed the NAM, the non-animal models challenge. And then we also have Mohamed Kareh in this. He is the program manager for AI, and he developed the physical AI challenge that we will see later today. So if we go to the next slide, here you can see the, let's say, the daily job of the program managers and in the EIC, so what they have already been doing up to now. The first one is that they identify the candidate challenges that we have in the work program. So as you know, about well, more than half of the budget of EIC is open, but we also have a dedicated funding for challenges, for Pathfinder and for Accelerator, and now also for Advanced Innovation Challenges. And the second task that they do is proactive management of selected portfolios and projects. And there, the program managers, they work with the projects to overcome all kinds of innovation barriers. For instance, they work with projects on regulation, to make sure that projects that are working in a certain field, that they fully understand the regulation, that they also know what's coming up, so that the projects, when they prepare their technology, they can include all the elements that are necessary to comply with the regulation. Another important task that they do is also to work with the projects on transition to innovation, where they look together with the projects, what could be possible exploitation models? What is all the intellectual property that they need to take into account for building their business model? So this is what we call the EIC sectorial program management. And if we go to the next slide, then you can see all the challenges that the program managers have developed for 2026. So this slide gives an overview of the whole work program. And if we start on the left-hand side and we take the stream, the most upstream, that's the stream on Pathfinder. There you can see that there are so there's an open part for Pathfinder, which is 166 million, but there's also a challenge part of Pathfinder, which is 96 million. And if you go more to the right-hand side, you can see that there are 3 Pathfinder challenges developed by the program managers. Then there is transition, which is 100 million only for open. There are no challenges for transition. And then you see a very thin line. And this thin line is the advanced innovation challenges, because this is a pilot. And in this work program, we dedicate 6 million euro to these challenges. So if you follow the thin line to the right, you will see that there is 3 million for accelerating physical AI, and 3 million for translating disruptive new approach methodologies into practice. And then the 5 other challenges that we have are the accelerator challenges, and they are for a total of 220 million. And we just had an info day about the accelerator challenges on Friday. So if you are interested in that, I would recommend you to watch the recording of that info day. If we go to the next slide. So the main goal of the pilot of these advanced innovation challenges is to assess whether such a competitive stage-gated support, whether it can accelerate the path to the market for high-risk deep tech innovations. Because what we notice in the EIC, that out of Pathfinder, for instance, there are some very potentially very good prototypes coming out, but they find it, the researchers around it, they have sometimes difficulty to convince early users to try out these prototypes. And that is one barrier to the market, and we hope with the advanced innovation challenges to tackle specifically this problem of involving an end user to try out an innovation and to benchmark it to a conventional solution. And with that approach, we can also assess whether the early integration of demand-side actors, so the users or regulators when they are in the case of the NAMs, whether that early engagement, whether that can enhance the relevance, validation, and ultimately the uptake of breakthrough solutions. So we also hope to gather evidence whether these mechanisms can lead to more efficient innovation cycles and broader market adoption than other instruments within Horizon Europe in general, but also the EIC in particular in similar TRL levels. So we carry out this pilot now, we learn from it, and then in FP10 we will implement then the improved approach for this. Can we go to the next slide, please? So staged funding, that is the main proposition of these advanced innovation challenges. We see that often that is also happening, for instance, in pre-commercial procurement. And if you look here at this slide on the top, we see a typical staged funding project where we see that there are 4 phases. Phase 1 is solution design, where there are 4 suppliers in this case designing a solution. In phase 2, prototype developing, only the 3 best are continuing with that. And in phase 3, we see only 2 suppliers still continuing. Phase 4 is dedicated to really deployment at scale with a large volume of the developed product. So this is typically implemented through a pre-commercial procurement project. Now, in our advanced innovation challenges, we have chosen for 2 stages, stage 1 and stage 2, and they correspond roughly to the phase 2 and the phase 3 of the pre-commercial procurement model. But of course, we also phase 1 is also very important, but we have already funded that, for instance, through Pathfinder projects. So we have checked that for the 2 challenges that we have enough prototypes available to go to stage 1 and then eventually to stage 2. And we have modeled that then through the entry requirements. So what we're looking for, the possible applicants of this advanced innovation challenges, they should have a prototype with a breakthrough character that is already at TRL level 4. They should also have access to appropriate testing infrastructure, and they should have a letter of intent of an interested user with a very relevant and challenging use case. So that are the entry requirements. So you will see how they are translated specifically to the one on physical AI and to the one on the NAMs. But if you have those, then you can apply to stage 1. And in stage 1, we will select 10 projects, and 10 projects in each of the challenges, so in total 20. And there you can prepare and benchmark your breakthrough solution and explore their feasibility and viability. The stage 1 is a 9-month project, and the 5 most successful projects, they can continue to stage 2, where then you can further develop. We will develop the 5 most promising solutions and test them in real-world environments and with the involvement of more end users. So this is the scheme that we have. And if we go to the next slide, then you can see here the 2 challenges that of which you will be informed today. The first one is accelerating physical AI, embodied intelligence for the next frontier of AI-powered robotics. It will be 3 million in total, so 300,000 for each of the 10 projects that we will select. And the second challenge is translating disruptive new approach methodologies, NAMs, into practice. And also there are 3 million, also for 10 prototypes of 300,000 each. So with this, I want to end the introduction and give the word to Viorel, where he will explain further about everything you need to know to apply to this call.
Thank you, Anne-Marie. I hope you can hear me well. Good afternoon, everybody. Really excited to be here. It reminds me of 2019 when we did a pilot for what is now EIC transition. And yeah, that was also 2 years before, and it was very consequential in what we learned and how it influenced the fully fledged transition in Horizon Europe. So I'm convinced this will be the same. That's why we put this as a pilot, and the main goal is to learn quite a lot of things, and hopefully we'll apply and expand this in FP10. So moving a bit into the meat of the problem, let's see a bit what more information about the advanced innovation challenges, or we have a new acronym in our vocabulary, AIC. So by now you know that we are talking about stage funding, and not 3 as usual, but two-stage funding. So the stage 1, or sometimes we use interchangeably with phase 1, sorry, 300,000 euros lump sum, and more exactly you'll see in a later lump sum type 1 for up to 9 months duration. And the idea here is you are prepare a bit, adapting your solution that has the entry requirements that Anne-Marie mentioned. And very important, you demonstrate the feasibility and benchmark it. And then stage 2, for the lucky one that will be selected, you will receive more money, up to 2.5 million euro lump sum type 2, more exactly, for up to 2.5 years to advance your TRL and test the solution in the real world environment, and very important also with users. Another characteristic is that we have for this, and we think it's important, or at least we try to test this, demand-side integration. So we want to have a tight integration from the beginning, basically commercial users, and this is very wide depending on your business model, B2B, B2C, and so on. So it can be in private or public, basically procurers, industry, obviously they are private procurers, and then can be also end users. But especially I can imagine for the second challenge, you may want to also collaborate with regulatory bodies or any other major stakeholders that you think they are crucial for the success of your projects. For, I would say, obvious reason, in the stage 1, we want to have a single entity, but we will extend to small consortia in stage 2. And what is clear is that we'll have what we call proactive portfolio management steered by the PM. Again, another hallmark of this new approach. Next slide. So I think Anne-Marie developed very well why we have EIC, who can apply in the stage. So in stage 1 is an open call, so there are no limitations as long as you have the right TRL. And there is a limitation in type of entity. Corporates cannot apply to stage 1. And then in the stage 2, obviously, it's a restricted call. It's restricted to the previous participants, including extending to a potential consortium, as I mentioned, of maximum three entities in stage 2. So what supports, you know by now that you'll have we have exactly 300,000 euros, so in total by 26 million, and stage 2, we are talking about 25, so 10 projects, each up to 2.5 million, which makes exactly 5 million euro. And then for the stage 1, we'll open the call already this year, and we will close it on 26 February 2026 at 5 p.m. Obviously, you are strongly encouraged to apply well before that. And of course, you will benefit from for the business acceleration services coaching and the proactive support from the PM and supported by project officers. Next slide. Okay, let's go a bit into detail in stage 1 and orientatively 2, and then talk more about the evaluation criteria and so on. So as already mentioned, you will need to have an existing prototype or existing result that should be at TRL 4, perhaps 5, but not more than that. Otherwise, you go directly to accelerator. You are expected in the stage 1, after some customization, to and to demonstrate that what you propose is feasible, and it's benchmarking against other solutions from the same portfolio, but also against the state-of-the-art solution. Obviously, we want something that is better, obviously novel, but also better in terms of performance, cost, and so on. There will be some workshops, or at least one workshop with other stage 1 projects, including external experts and other potential users that the one you came with. And obviously, the program manager will provide the strategic guidance, as we are mentioning. There is also the PMs will also encourage collaboration and learning across projects, and you should allocate it in your cost calculation, your budget calculation, at least one person month for these portfolio activities. Next slide. Excuse me. A few words about stage 2, but again, this will be it's already described in the work program 26. However, without preempting the work program 27, where will be described and legally will be the one that will have precedence. So in the stage 2, obviously the idea for the one that are selected is to further develop towards TRL 6 and 7 or 7, the most probable solution. You will have obviously at least formally to meet a new proposal via FNT funding and tender portal, which will be limited to 22 pages. Obviously, if your project, the stage 1 project, doesn't go according to the plan, then you should ask yourself if it still make sense to do this, but up to you. And we'll provide more detail in work program 27. And in term, and as mentioned, will extend from mono-beneficiary to small consortia, and you will have, in terms of evaluation, to do a pitch in front of a jury, which will be chaired by the PM. And as mentioned, obviously, the performance and the results of stage 1 will be featured prominently in this evaluation. That's one of the main characteristics. And then the evaluation will also assess the readiness of the solution and the scalability for the market update. In terms of evaluation, we aim to inform you after 6 weeks after the second stage call closure, which is, I would say, quite ambitious. Next slide. Sorry. Let's go now a bit more into detail about the evaluation for the stage 1 and application. So we are talking here about short proposals, 11 pages for the section 1 to 3. So because we are talking here about shorter mono beneficiary, 9 months and 300,000. So again, the evaluation, it's a two-step evaluation, one stage, two-step evaluation. Basically, in the first step, we'll allocate 3 independent evaluators, which will score you independently, or they will not know each other and so on. And then in the second step, the portfolio consideration. So all the proposals that were above the threshold in the first step will be looked at by the PM and the small evaluation committee. And the idea is to select a balanced, let's say, portfolio of up to 10 projects. And then you will see the PM will provide you immediately more detail, like what are these criteria and what they mean with a balanced portfolio. From our side, we definitely will try to, again, this is a pilot, so we'll try to see how to achieve the very short time to inform and time to grant. So if the time to inform or the first the evaluation, it's up to us, then in the gap, obviously, you are also an important actor, so you should be prepared to finish this as quick as possible and to have these documents that ready, that will facilitate, namely the financial identification form, bank account validation, and so on. So definitely you need to be ready for this. And again, the call will close on 26th of February. We have evaluation filing the gap. The idea is to finish this gap and to sign the contract well ahead of the 1st October. But in the worst case, all the projects should start at the latest at 1st of October 26, more or less in the same time, so that we have enough 9 months for the challenging stage 1. And you see a bit in a graphical form, how does it look, the process. Next slide. As I mentioned, we have 3 independent experts. They will rate they will score your application separately with the usual criteria: excellence, impact, and implementation. We'll see in a minute the sub-criteria and comment on them, and then we'll make the average and the overall score being the sum of all of these. But again, in the second stage, the portfolio consideration, all the proposal will enter that are meeting the threshold, obviously, will enter, and the proposal and the PM, together with other experts, will look at them, but not in a strictly ranking list, but how will they fit together to have a coherent set of to have a coherent portfolio. Next slide. And then more in the second stage of the portfolio selection, they will select this suitable portfolio proposal, basically all the 10 projects, with the goal to have this balance approach and cover as much as possible the different approaches. Okay. Next slide. Let's look now a bit into more detail about the evaluation criteria for stage 1. Okay, for stage 2, we also, the work program mentioned this, but you clearly see that they are they may be refined in the work program 2027. So at least some of these sub-criteria will sound familiar with you, I hope, if you have already a Pathfinder project or even have applied to the transition. So the first sub-criteria, clarity and relevance of the innovation idea, with 2 basically sub-points. First, what is the problem that you try to address, how well it's described and how relevant it is, but not only that, also if your proposed solution is really solving it in a compelling way. So it's an end-to-end, so it's a more complicated than one. And then the second sub-criteria, the novelty and the breakthrough nature. Obviously, we are looking for solutions that are really novel compared with the state of the art. This definitely is not new to you. And then obviously we are looking for something that have a disruptive potential. More detail on what it means, this one next. And then obviously what we want is that these performance improvements are there, they are above the state-of-the-art solution, but they are realistic and credible. And again, here, let me highlight that we are talking about technological excellence, not about scientific excellence. We are starting at TRL 4 here. We are not starting at TRL 1. Next slide. Please pay attention to impact of your proposal. This is usually the weak part of many of our proposals. So we are looking the first sub-criteria of impact. If your proposal have potential to develop new markets or to significantly impact the existing ones. So this is if you want a typical wording from disruptive innovation, if you are familiar with Clayton Christensen work. And then the second sub-criteria is your innovation bringing sufficiently added value or very high added value so that it becomes attractive, whether for investors or for potential customers. This is very important, okay? And then we will look, or the experts will look, if the expected impact, because it's all about the future, and mentioned in your proposal, are really credible, because obviously the paper never refuses ink. And not only they are credible, but they are also important. They are substantial. Okay, so I think that's very important to take into account. And just to make a small comment here, because if you wonder, for example, why we don't have an interview here, because the jury phase we have in Accelerator, in the transition, the jury phase would be very useful to test this credibility, to probe this credibility. but please do not forget that this is a stage approach, okay? So it's not only that you have to be successful in the evaluation, you will have to be successful also in the stage 1. So what you will promise has to be really realistic. It's not just enough of over-promising and under-delivering, okay? Thank you. Next slide. And then, of course, implementation. This has an equal weight with that. Again, typical work plan. If your work plan is realistic, obviously within the exact 300,000 euros and allocation of resources to the various work packages. Again, we're talking here about mono-beneficiary. And then about if the team that you have to execute this project, because, okay, it's a mono-beneficiary, but obviously it's a team approach, has the first capacity and the expertise to implement the project, but not only that, to move decisively towards the market. In other words, here is not just it's not a research project. We are not looking for that expertise. Of course, that as well, obviously, to need to increase from TRL 4 to TRL 6 or 7, but you also need to move towards the market. So there is also some business aspects that are important here. Next slide. Going a bit more into detail, definitely pay attention to the proposal template. It's a new template that we designed specially for the phase 1. And you see here some of the guidance that you will find there, and you may recognize some of the wording from the Hallmeyer Catechism there. Articulate your project using very little or preferably no jargon. So definitely, I mean, it's not like in the transition that there is the risk to have a older template, but here you will find the template, and I encourage you to pay attention to the instruction. We try to make it as easy for you as possible. Next slide. And yeah, here are the full list of what I mentioned, the Hallmeyer Catechism, and you will discover along the template some, if not all of these questions spread all over the template. So hopefully this will help you a bit beyond our usual, let's say, wording. Next slide. Just to mention that in this is a novelty, at least for our calls till now, that use type 1, that use lump sum. I mean, already we are now in the second year they use lump sum, but we use till now type 2. Here we are looking at type 1 or even type 1A if you want to be pedantic. So the amount is exactly 300,000. You can see, if you are curious, in the right-hand side, a bit of the estimation done by the PM. And I think this pilot is already breaking new grounds, because this is the first time that we have type 1A justify on expert assessment. Okay, we used the type 1A in Horizon Europe till now, but was only based on let's say statistical analysis of the past proposals, and we are talking here about Innovation Launchpad and of course about ERC POC. But here is the first time, and it's allowed by, obviously, by financial regulation, who specifies several other methods to justify this amount, and we are doing the first time looking forward, not backward. So yeah, and we will. So you will have to use this, and you will put also in, when we open the call, the link to the Commission decision in this respect. Next slide. I think that's the last slide. So all in all, 6 million euro is not a lot. Nevertheless, it's an important first stage. We hope to open the call on 3rd of December 2025, and we will close it on 26th of February 2026. And we are waiting for your proposals in exactly 11 pages. Thank you very much. Alina, I suppose that
yes, I'm sorry,
have
I was muted. Sorry,
questions.
I'm very sorry. Thank you very much, VRL, and Anne-Marie for this. I would like to go through the questions because we are quite some minutes over time. So, does the stage 1 proposal need to explain the main milestones that will be achieved during the second stage of the project?
Yes, absolutely. And if I'm not mistaken, this is
No.
no? No?
It asks the stage 1 proposal if it needs to explain the main milestones for the second stage.
Okay, no, yeah.
That is not the case.
Indeed.
So the stage 1 proposal, it focuses on stage 1. It's only in the impact criterion that we want to know also what is the expected impact beyond the first stage.
Thank you, Anne-Marie, for the clarification. Will large private companies be eligible for the second stage in a consortium with the SME that applies to stage 1?
Yes. Indeed, that's why we put a small consortium. Now you have to determine in what capacity they will be. Are there like a potential customer or a contributor to the development of technology?
Okay. Thank you very much. For stage 1, would a system level demonstrator like Hanami Circular Tech measuring real-time circulation of products, money, data, science, or business in parallel be eligible, or must the innovation be a single physical technology? And if eligible, advanced innovation challenges or another AIC stream?
Wow, that's very specific. I don't know, Anne-Marie, but to me looks
No, I
like
don't know
not.
the answer either, but I suggest that you listen to the explanation what we are looking for into the physical AI and into the NAMs.
Yeah.
And if this is a physical AI or a NAM, maybe, but we only are looking for those two topics.
Indeed, but for me, like at the first look, it doesn't look like eligible to be honest.
Thank you very much, both. How does AIC define TRL readiness for innovations that combine digital infrastructure with new economic models?
So this is again this Hanami circular tech. So we have our TRL levels defined in the work program, so you can look them up, and please listen to the upcoming presentations in a minute to see whether you apply, you are, whether you make sense you apply or not.
Indeed, Anne-Marie, and the applicants, they can look into, for example, the FAQ of the transition. We indicate there 2 URLs from your access where you also have the TRL applied to the various domain from pharma, tech, and software, etc. But I'm afraid that we are not do not have a TRL definition to combine digital infrastructure with new economic models. Sorry for this.
Thank you very much. The following question. I understand that the typical starting TRL is 4 and the typical target TRL is 7. What TRL is expected to be reached after the first stage of the 9-month stage of the project?
I would also like to defer this to the 2 specific challenges that we have, because what you need to do is you need to benchmark your technology in a realistic infrastructure, and so it could be that you go up 1 TRL level, but maybe it differs also in the physical AI one than in the NAMs. So let's take this question with when those 2 challenges are explained.
Thank you. Why should one apply to the EIC Advanced Innovation Challenges, given that the projects fit the challenges, and not AIC Transition, given that the entity is eligible? It is rather confusing since the start and the end TRLs for both calls are the same and similar.
Well, good question. First of all, the TRL are not the same or are not exactly the same. In the transition, we start a bit lower in terms of TRL. You can apply even if you are a TRL 3. And our end TRL is TRL 6, while here we're starting TRL 4, and then the target is to go to up to TRL 7 if possible. So you see already there is a slight definition, a slight difference. And in general, what we see is that the chances of success when you apply to a challenge are normally much higher or even much higher than when you apply to an open call. Okay, so you may want to take that into account, to decide a bit between the two.
Thank you very much, Viorel. The next question. Is it possible for former beneficiaries of AIC Accelerator to apply to Advanced Innovation Challenge with an advancement of the tech, which is at a lower TRL?
I don't see how this would be possible. I mean, to me, to be honest, look like a very opportunistic behavior, which I personally do not encourage. I mean, yes, accelerator, even at application stage is TRL 6, which is too high. If you are a former beneficiary, it's assumed that you advance it at least to 7 or even 8. And then I personally, I found difficult to understand how you would kind of bring this lower. I mean, I would say focus on to advance and to the commercialization and so on, and attract private investors rather than, trying to go back. It will not fly, to be honest. It doesn't make sense.
Thank you, Viorel. The next question. Is financial risk a must in this call as it is for AIC Accelerator?
Well, look at evaluation criteria. I don't think we have such a criteria.
No, indeed.
Thank you. The use case providing the letter of intent can be an SME or should be a large industry.
That doesn't matter. It can be both, as long as it is a very relevant end user for the case that you want to, where you want to benchmark your solution.
Yeah, but also look at the evaluation criteria, because, for example, the impact says to what extent the expected commercial impact despite the proposal are credible and substantial within the project and beyond. So if your SME, can demonstrate a substantial, commercial impact, yes, but if not, then think a bit.
Thank you. I think we have time for one or two questions. I understand that the participation of large entities as a single applicant is not allowed either in stage 1 or in stage 2. However, is it possible for them to join a consortium at stage 2 as members?
I think I mentioned this, yes.
Yeah, we had the same question before. Yes. So it's possible, for instance, also as end user.
Yeah. Okay, thank you. Is Switzerland eligible to apply for the Advanced Innovation Challenges pilot under the European Innovation Council?
Yes, I mean, I think it was a week or two ago, Switzerland became fully associated to the Horizon Europe, hence is eligible for this pilot, which again, it will be in 26.
Mm-hmm. Okay, thank you very much. Viorel, I understand this is a lump sum, but what is the funding aid intensity, funding percentage used when calculating the lump sum of the project costs? Is it 70%, 100%?
It's 100%.
100%.
Exactly.
Thank you. And one last question or two maximum. Can an entity apply for more than one Advanced Innovation Challenges proposal if it has different topics addressing the same challenge, or should it address them in one single application?
Look, I mean, I think you should look first and see what kind of drives you this. Are you motivated in this great opportunity, or just look at it as a you know, kind of opportunity or so. I would definitely try to address in one proposal. Okay, again, the first is a mono-beneficiary addressed to basically universities and SMEs, basically at RTOs as well. So why you would apply with two proposals? I mean, imagine this, if you have two, are you able to execute them both? How credible is this? So I would not underestimate the difficulty of this evaluation, and I will focus basically.
Thank you very much, Viorel. Thank you very much, Anne-Marie. Unfortunately, we don't have time to take more questions at this time. Maybe if we have some time at the end. But anyway, for the questions that remained unanswered, we will provide an answer through our FAQ list on the AIC website. Also, before going to the next question, I would like to very much encourage you to fill in the satisfaction survey, because this will help us improve for the next sessions that we will organize. Thank you very much. We will now go to the next session where we will discuss the accelerating physical AI embodied intelligence for the next frontier of AI-powered robotics, where the AIC program manager Hedi Karay and Cem Gulek from DG Connect will talk to you about what they are looking for in this challenge. So, Cem, the floor is yours. Thank you.
Thank you very much. Good afternoon, everyone. So I'm going to provide a small policy introduction before Hedi presents the challenge itself. You can go to the next slide. Just quickly, I'm working the AI office in the unit that is named Excellence in Artificial Intelligence and Robotics. This slide explains very well the ecosystem, so I will spend some time explaining it. On the left side, you see the ecosystem of trust with all the regulatory aspect, the AI office and the AI Act that is being developed by our sister unit in Brussels. We are located ourselves in Luxembourg. On the right side, you see the ecosystem of excellence. You can see that there is a cycle here that goes from low TRL to high TRL, with funding instruments such as Horizon Europe on the right-hand side and Digital Europe on the left-hand side. It starts with ADRA. ADRA is the private side of the public-private partnership. We are working closely with them. It is the partnership in AI, data, and robotics. Now, the three domains have been merged under this PPP, and we're working closely with ADRA. ADRA is producing at regular basis, updating the SRIDA, the Strategic Research, Innovation, and Deployment Agenda. This is for us in the European Commission a useful tool, and we are using it to define our funding programs. And there you see on the right-hand side the second box, research and innovation. All our projects are being designed taking into account the SRIDA of ADRA. And there we have a number of projects that are about AI, data, and robotics, and we have already spent several hundreds of millions for robotics, but it's a bit difficult to discriminate what is robotics, what is purely AI, because AI, robotics, and data are very often mixed nowadays. We also have a network of excellence centers. Those are the best researchers in Europe that are working in specific domains, and we have network of excellence centers with some particularities, some specificities, and one of them is dedicated to robotics. Then you see in the next block we have the AI and the one platform. This is where project can share the results, the algorithms, the deliverables, the document, the reports, and this is also a place where the industry can join, and also there is a marketplace there. You see then under the Digital Europe program, the testing and experimentation facilities. So now we are getting higher in TRL. This is the last stage for the testing. So developers are testing the AI, data, robotics solution in real world or close to real world environments. And then we have still under Digital Europe program, the EDIs, the European Digital Innovation Hub, that are more addressed to the users, to help users to test before invest. It is there to support the companies that want to uptake AI data and robotics solution. This is the classical description of the ecosystem that we have. You can go to the next slide, please. But in between, we had the GenAI4EU initiatives that have been announced early 2024 with the AI innovation package. We had earlier this year the AI Content Action Plan, and one pillar of the AI Content Action Plan is the development of algorithm and the Apply AI strategy. So this Apply AI strategy is to foster the uptake of AI solution in companies. It is for businesses to consider AI as first, as a useful solution to tackle their challenges while considering the risk. It is also supporting adoption and integration of AI in 10 strategic sectors, and you will see the public sector, but now for robotics we are focusing on the industrial sectors, and we'll have the list of them in the next slide. And tailored action to sector-specific needs. So for each sector, we have a number of actions that are sector-specific and use case-specific to enhance competitiveness of European companies. You can go to the next slide. Here you see the 10 strategic industrial sectors. One of them is on robotics. So I'm focusing today more on robotics because it is an introduction on the policy side for the challenge in robotics. And we have a specific section on robotics in the Apply AI strategy. This Apply AI strategy has been published very recently. It was in October, 1 month ago. And we have a section on robotics. And I will explain more in detail what we have there. You can go to the next slide. Sorry, there is this 2 slides before robotics. We also have cross-sectoral AI challenges that are not sector-specific, but cross-sectors. We want companies to have easy access to the AI experience centers. Those are the ADs which functions are increasing and are much broader now, and that are helping companies to uptake AI solutions. We want to bring together EU leading actors to support development of frontier AI, and there is a specific frontier AI initiatives under this Apply AI strategy. We want to ensure trust in the European market and help workforce to be ready to uptake and use AI solutions. And for that, you see on the right side, we have a governance structure, the AI board. This is the coordination with member states, the Apply AI Alliance, which is a unique entry point for stakeholders to shape their AI policies, and the AI Observatory to monitor AI trends. You can go to the next slide. Now I will focus more on robotics. So the robotics section under the Apply AI strategy. One of the main action, which is the Apply AI flagship, is the establishment of the European Robotics Catalyst. This initiative is driven by end user. You see, as the main objective of Apply AI is to foster the uptake of AI data and robotics solution. We are focusing on end user industry, not only, also on developers, but the end user industry should drive the technological development. This is we are strengthening the focus on that because we want uptake to be really addressing the needs of the user. And below that catalyst, which defines the priorities, defines the enabling building blocks, we have several smaller initiatives that are completely part of this European Robotics Catalyst. We have the robotic skills boosters. So when here, it's not about the skills of the user, of the people using robots, but the skills of the robots itself. It is the ability of the robots to perform certain tasks and we are going to develop, and it will be part certainly of the work program 26. I cannot say more because the work program is not approved yet, but we may have a challenge-driven topic as for EIC to develop skills of robots. And the type of skills that we would like to be developed under that topic, if approved finally, but we're in the ultimate phase of approval, is advanced manipulation in unstructured environment and dynamic environments, advanced navigation in dynamic environments, or interaction skills. After that, we'll also have robotic skills qualification centers. So it would be like an environment to assess the capabilities of robots, to give our robots like a diploma, like we're giving at university to the students. They are able and they are qualified for doing certain things, and we do the same for robots. So those are robotic skills qualification centers that are going to be developed under the testing and implementation facilities. And finally, the sectoral acceleration pipeline. This is an integrated pathway from the lab to the market. We want to develop still also end user driven. So research and development is driven by end user. And we want to have a continuum from research to the market. And the first one, the first acceleration pipeline, will be dedicated to manufacturing, including robotics, because robotics has a role in manufacturing. You can go to the next slide. And we have already some actions in the pipeline to support the supplier strategy. I'm currently evaluating this week a call under Horizon 2025, which is robust and trustworthy generative AI for robotics and industrial automation. Those are foundation model for robotics that would enable robots to be more autonomous, adaptable in real time, and to increase their capabilities. Other type of investment that are in the pipeline, it's not only to have general purpose brain, the Gen AI algorithm, but also the bodies of the robots. So body of robots platforms that are easily adaptable to various tasks, that are safe, flexible, and human-centric, and that are general purpose. Also, something that is in the pipeline, modular, interoperable and integration toolkits to allow SME to more easily uptake robotic solution. Because when you develop a solution, especially for SME, it's more difficult for them to uptake solution because there is this issues of interoperability and integration with the existing system. And this I already mentioned, advanced robotic skills and qualification framework that are clearly defined under applier strategy, and also having trusted industrial data infrastructure, because without data, we cannot develop this Gen AI model for robotics. And we have a call under DEP that is in the pipeline for 2026 that is specifically addressing robotics and manufacturing. And I believe this is all, because the last slide is like a recap, but I understand we are in a rush. So I will let Hedy to hand over to present the challenge in robotic. Thank you very much.
Thank you, Sam. Thank you, Elena. Yeah,
so go ahead, Hedy.
Yes, please. Thank you. Thank you very much. Hello, everyone. So I'm Hedy Karay. I'm the AIC program manager for AI and managing this exciting challenge about accelerating the physical AI. Next slide, please. So yeah, physical AI is changing how machines work in our world. Let's say by teaming up AI, robots, sensors, and smart connections that could accelerate to improve machines' capabilities, robot capabilities, to see, to decide, and act on their own in real life situations. So as AI capabilities and let's say approaches keep improving, many experts expect that in the next 10 years, we will see major breakthroughs and a big wave of physical AI deployments. Soon, AI won't just help online. It will shape the real world. So working alongside people and transforming our daily lives, industries, cities, and so on, in ways that are only beginning to emerge. So the impact is already reshaping and will reshape industries, and let's say turning rigid automation into flexible intelligence systems that boost productivity and response to the, let's say, to the complexity of the real world. Next slide, please. So the physical AI and robotics market is seeing an explosive growth that may even exceed current projections. Anyway, beyond the accuracy of those projections, analysts estimate that the global robotics market will surpass 160 billion by 2030, with embodied AI reaching over 67 billion by 2034. In Europe alone, autonomous robotics is set to triple from 8 billion in 2025 to 24 billion by 2035. Next slide, please. So in that context, this Advanced Innovation Challenge was launched to speed up the move from the idea to real working physical AI in Europe. It aims to help create new technologies that, let's say, make Europe stronger, sustainable, and more competitive. Next slide, please. So technically, this challenge aimed to close the gap between what AI can do today in the digital space, like chat robots and so on, and what is needed in the real world. So helping to build intelligent physical systems that work safely and well also in challenging real settings. So to deal with that gap, I think that a deep tech approach is needed. We expect big breakthroughs that makes robotics, smart materials, and sensors, and so on, in order to deal with this real gap. Next slide, please. So accordingly to this gap, let's say this challenge seeks proposals for developing disruptive physical AI innovations that demonstrate at least two of the following aspects that I will detail in the next slide. So we have, let's say, 5 aspects that we are interested in that I will develop. Next slide, please. So we are looking for a breakthrough that, let's say, lets machines or robots truly understand and sense the world around them. So having more awareness about their environment, so they can safely and smoothly handle challenging real life situations. So this means that they need smart ways to see, to learn, to build world models, to reason and make quick decisions, getting closer to natural intelligence that we know in, like, for humans, for animals, and so on. So this is the first aspect about perception and cognition. Next slide, please. So here we are looking for breakthrough that help physical agents to do their work more accurately, make fewer mistakes, and let's say stay flexible as things change in the real world. So consequently, they need to be capable of adaptive learning and optimization, which means that they can keep getting better, adjust to different jobs, and manage their resources smartly on real time. So this is what we are looking for when we talk about adaptive learning and optimization. Next slide, please. In addition, we are also expecting to, let's say, combining real-time problem solving and autonomous actions with swarm coordination to create strong group intelligence. So this lets multiple robots and machines quickly understand complex situations, make fast decisions, and work together seamlessly to enable powerful solutions for challenging tasks like rescue mission, smart factory, and so on. Next slide, please. Regarding the human-AI collaboration and the human centrism, so this is very important, and for that we are looking for real breakthrough where AI builds seamless and trusted partnership with people at work and in everyday life and every situation. So human-AI collaboration should focus on making things safer, smoother, and more comfortable thanks to, let's say, assistive devices, humanoids, cobots, and smart infrastructure that work alongside human, but in intuitive and secure ways. So this is what we are looking for in terms of human-AI collaboration and interaction. Next slide, please. So in addition to this, like, let's say, different capabilities, we are also expecting breakthrough from the hardware side. So that will expand what robots and smart machines can sense, so can do or can achieve in the real world. So this will be, let's say, driven by different approaches, like ones inspired by, let's say, bio-inspired designs, like sensors and smart skins that feel, touch, pressure and temperature, plus advanced vision and haptic devices, strong and flexible actuators for precise control, and inventive materials also that boost durability, adaptability, and real-world performance in embodied AI systems. So we are also interested on that, let's say, hardware side of the capabilities. Next slide, please. So those technical expectations or aspects that we are focusing on must also focus on addressing pressing needs in at least one of the following application areas that I present here. Next slide, please. The previous one, sorry. This is the second application. Yeah, so the first one is the, let's say, disaster response and civil security domain. Here we are looking for AI-powered robotic system designed to act before, during, or immediately after disasters with aim of saving lives, ensuring safety, restoring the normalcy in hazardous environments. Next slide, please. So the second application domain should address the autonomous labs for scientific discovery. Here we are looking for self-directed scientific environments where AI and robotics design, execute, and analyze experiments with minimal human intervention. Next slide, please. And the third application domain is about personal or professional robot assistance. So here we are looking for AI-powered robots designed to support individuals or professionals by automating repetitive, manual, or complex tasks in homes, workplaces, or industrial settings. So here we include humanoid and cobots and so on. Next slide, please. Yeah, so as already mentioned before, proposal will be evaluated by a committee consisting of the AIC experts and chaired by the AIC program manager responsible of this challenge. So it's myself in this case. So in this process, a portfolio approach will be used to get a variety of potential solutions. So the goal is to fund a diverse and strategically coherent set of projects that, let's say, best address the whole objectives of the challenge. So for that, we will take into account two criteria, the technical coverage. So here we talk about the different aspects I have listed from the technical purpose, And then also the domain coverage. So the 3 domains that I have mentioned in order to make a balance within the portfolio selected projects. And then also that will allow us to create and to develop portfolio activities later. Next slide, please. Yeah, this is very important. So the physical AI solution that will be designed and developed under this challenge should be in accordance with the principles of responsible AI. So that include all the European values, including trustworthiness, security, human centrism, ensuring the transparency, accountability, privacy, safety, and all ethical alignments that we are looking for in that European perspective of AI. Next slide, please. Yeah, so I think this is already said for the global advanced AI, advanced innovation challenge, but from the AI perspective, let's say that applicants must demonstrate the interest of potential end users and integrators with a view to support the application and testing of the proposed solution in real-world environments. So to enable this, applicants should have firstly an initial physical AI system prototype tested in the lab. So here, I'm anticipating the question about the TRL. So we are looking for a prototype tested in the lab. This is the minimum entrance requirements. Also, an access to an appropriate infrastructure for data collection and testing. And finally, a challenging use case formulated by a potential end user regarding the 3 domains we already listed here, or also, should be confirmed by a letter of interest from the end user or an integrator. Next slide, please. Yeah, so let's say solutions supported under the challenge are also expected to demonstrate both novelty and applicability of the proposed physical AI technology. And then also they need to think about associated risks and how to mitigate them from the first stage. So for the 9-month period, project should ensure the following. So firstly, they have to refine and validate the prototype in a relevant environment to demonstrate the core innovation with their use case. So it's not necessary to move from TRL 4 to 5 or to 6 during the first 4 months. You can still be in the same TRL, but you refine and validate the prototype. Then develop a methodology for performance assessment. Assess the ethical data governance and scalability consideration. Identify challenges to integration such as safety, certification, and so on. And then also even anticipate on identifying risks about adoption and barriers of adoption. And also conduct initial performance benchmarking and develop an initial market analysis and business plan and model and so on. So those are, let's say, the main activities that we are looking for this 9-month period. So next slide, please. So, when focusing on this list of activities in the first stage, let's say we are expecting 3 main milestones. So the outputs of the stage 1 will be assessed regarding 3 milestones. First one is the evidence of technical viability with initial performance data that benchmark performance and disruptive potential against the state of the art. So this is the main milestone to achieve, is this evidence of technical viability, and then also, within the specified application area for sure. Also, a clear commitment from the end user and stakeholders to further develop this physical AI solution in the second stage, as well as also delivering the full proposal for the stage 2. So those are the main milestones for the first stage. Next slide, please. Yeah, so the stage 2 is about development and user testing. So this is what is already presented. So let's say applicants for stage 2 will be expected to further develop and validate their physical AI solution. So I will not go through what is expected in this stage 2. It's just here to make clear distinction between what is not expected and what is expected and what is not expected in stage 2. So to see the difference between the two stages. Next slide, please. And same here for the milestones. So here is to tell you, we are expecting from you in the impact session having a long-term projection, but we are not expecting at this stage to achieve, I mean in stage 1 to achieve those milestones. Those will be for the next stage. Next slide, please. So to summarize and conclude, let's say that it's urgent and it's a European need to bridge the gap between top-class AI research and real-world physical AI to stay competitive for Europe. So achieving this now is crucial for European independence and sovereignty in vital sectors. And thanks to the advances in AI and robotics, breakthrough physical AI is finally within reach. So, and we are, let's say, expecting that you contribute actively in that. So this challenge also, as presented by my colleague, this challenge will support the ambition of the AI Act, the Apply AI strategy, and the Resource for AI in Science in Europe strategy, and then contribute to the European priorities in sustainability, resilience, digital transformation, and industrial competitiveness. So that's all, I think, from my side. Thank you, and questions are welcome.
Yes, thank you very much, Hedi and Tim. So for everybody, can we show again the Slido code, please? Okay, so thank you very much for posting this. Now I will read the questions one by one. Regarding the requirement of a starting sorry, we lost it. Okay. Would this call consider proposal addressing physical AI based on new AI architecture? Is the proposal focused on using existing AI technologies, LLMs, and etc.? Hedi, you are muted.
Sorry, yes, I'm muted. Yeah, let's say that's why also I have mentioned, like, we are looking for deep tech approach. So when we talk about deep tech, we are like looking for breakthrough. You can use existing technologies, but we are looking for going beyond. So that's why it's important to have this in mind and not only do incremental things, but really work on disruptive architectures, approaches. But I mean, I think that we need to go beyond LLM. It can be used, but also think about improving and have new kind of ideas, let's say that.
Thank you, Hedi. Do you fund the application of AI in specific physical sectors, for example, AI to enhance laser material processing, or should the project be more general?
As I said, there is 3 main application areas: disaster response and civil security, automated science discovery labs, and let's say personal or professional assistant. So if this can be like an assistant, for example, within a manufacturing setting, it could be covered. Else no. So we have only 3 main application areas. Yes. Okay. For this one, I mean, it's a single or mono applicant. So the mono applicant could be a spin out or spin off of the university, a research team with real like projects of spinning off, or it could be a startup already spin out from a university or SME, or so it's really open for mono applicants. Yeah, it will be 10 projects will be selected in the first stage. Alina, you are muted.
Oh, sorry. If we are an AI lab company, do we need a robotic OEM within the consortium?
It's mono applicant. You can have it if needed. You can have it in the next stage, but for now is I mean mono applicant.
Can the funded entity be does robotic solutions on the medical field fall under the scope of this call?
It depends. If it's a physical AI solution that assists medical, I mean medical doctors, for example, that could be. Also, if in the medical field, if you have like a lab, a fully automated lab for drug discovery, so that's covered also by the second application area.
How can we substantiate the existence of a prototype in the lab?
Yeah.
Especially if important IP underlying the concept.
Sorry, I don't see which question, which one this.
Yeah, because yeah.
It's
How
now
can
black.
we substantiate the existence of a prototype in the lab, especially if important intellectual properties underlying the concept have not been secured yet?
I mean, that's why we say, like, I mean, if for example you are in the lab, so the applicant will be the university, so that's the mono applicant. So that's why, I mean, this is important to have the prototype already there and already in the lab.
Thank you. We're well beyond early stage with 100 plus global B2B customers.
I don't see also the question.
Yeah, just one
Sorry.
moment, because this question on the AI lab company was answered. So we are going to the next question. Are visual and computer vision based technologies that are not necessarily integrated into mobile robots applicable?
It could be like, I mean, when I talk about physical AI, is not only robotics. It's like if you have a system that embodied AI, for example, that can be embodied in any other system, that could be also, yeah, eligible.
Thank you. Does the required starting TRL 4.5 refer to the AI capabilities or the overall system capabilities?
It's more on the AI capabilities.
Thank you. Is the advanced innovation challenge particular to AI and similar software digital technology, or does it include hardwares like clean cooking technologies?
So as I said, like we are looking for the capabilities. So it could be from the hardware side, but it could be for the software embodied in the hardware. So that's the thing. It should be not, I mean, we are not looking for separate software solutions, but it has to be embodied in the physical hardware.
Okay, so in a way, this answered the next question. Is embodied intelligence relating to hardware, e.g. soft biorobotics or software learning architectures?
I mean, that's same as like it should be related to the hardware part. So it should not be, let's say, a software learning architecture, but should be embodied within the physical AI system, the physical system.
One or two questions more. Does healthcare count within industrial application within this call?
As I said, it depends to the application and to your use case. If you are in the case of a physical AI that assists to do things, yeah. In the scope of healthcare or industry or any other domains, let's say.
Mm-hmm. Do this proposal take into account industrial deployment, or is it sufficient proving TRL level compatibility?
So, as I mean, industrial deployment will be the aim of the next stage. So at that level, we are looking for the TRL level compatibility, but also the engagement of the end user. So this is important from the beginning to have the engagement and the interest of the end user, and this is also translated by the use case. So it's not, let's say, an entry requirement to already have industrial deployment.
Thank you very much. So I think we will stop here with the questions. We will answer the remaining question through our FAQ on the AIC website. And again, we kindly ask the audience to fill in the satisfaction survey and help us improve. And this is the QR code where you can answer our satisfaction survey. Okay, now we will transition towards our second challenge under the Advanced Innovation Challenges 2026, translating disruptive new approach methodologies into practice, a challenge built by the AIC program managers, Orsolia Simons, the AIC program manager on health and biotechnology, and Federica Zanca, the AIC program manager on medical AI and medical imaging and AI in healthcare. In this session, we will hear also the policy context from Christian, the scientist from DG RTD, and Kyriakos Hatsaras from DG Connect. And we will have a colleague from the JRC, Ispra Milena Menekotsi, to tell us about the JRC infrastructure. So, Ushi, the floor is yours for to present this challenge. So sorry, Christian. My apologies, Christian, to present the policy context for the new approach methodology. Thank you. Christian? I think I believe Christian is not yet with us.
I see.
I see. Yes. Christian, can you hear us? I believe Christian maybe he joined as a guest. So Christian, if you can log in as a panelist, and until then we can hear from our colleague from DG RTD, from DG Connect, Kyriakos.
Oh yes, good afternoon. So Alina, Anne-Marie, may I start?
Yes, please go ahead, and then Christian can connect as a panelist.
Yes.
Thank you. So essentially, we will be starting from the bottom up. We from the European AI Office, we wanted to complement this session by offering a policy initiative example towards NAMs that Christian will talk about in more detail now just after me. I am Kyriakos Hatsaras. I'm a program officer for EU policies here at the European AI Office in Unit A6, Artificial Intelligence in Health and Life Sciences. And the initiative I wanted to talk to you about is called the EU Virtual Human Twins Initiative. Next slide, please, where we will see what this is really about. So essentially, with this initiative, we address the European human health and disease modeling and simulation ecosystem. The virtual human twins are defined as digital representations of human health and disease states. built using software models and data, and increasingly so with artificial intelligence, with AI. And they are designed to mimic and predict behaviors of their physical counterparts. Now, why is this important and indeed a core EU priority? First and foremost, Europe has had a leading position in this wider global ecosystem for several years. So essentially, in the first instance, it is about maintaining, enhancing, promoting European leadership. Then it is, of course, understood as a key advanced technology in the context of personalized medicine. And in that sense, we see essentially two high-level use cases for this. One is healthcare delivery, so clinical decision support, the most well-known use case, especially so for cardiovascular medicine. But also it is increasingly being used in the context of drug discovery and clinical trials, essentially now emerging from a preclinical domain onto the area where it can inform, for example, clinical trial design and next steps with the drug discovery process. It is, of course, as an advanced technology, does require advanced computing in itself. So we do have to leverage HPC, so high performance computing capabilities, and quantum when that perhaps reaches a more mature stage. And as with any new advanced technology, we do need that strand of medical education and training for our workforces to be able to use this technology to best effect. And in the first instance, when we look at both use cases, it is about advancing medical research as a first step. Next slide, please. So when we looked at putting the initiative together in terms of structure, we wanted an EU framework that will support not just the current state of affairs, but will support the emergence and adoption of next generation virtual human twin type solutions in health and care. And so our initial scanning of the ecosystem did show that it was rather fragmented in terms of approaches, methods, tools, standards as a basis from where to develop these technologies. And so we wanted an initiative that will foster, as it now does, an inclusive, collaborative, multi-stakeholder ecosystem, break down any silos and support interoperability, integration, and the scaling up of VHD-based solutions. Facilitate advanced research and technology, now including AI, so having artificial intelligence in the mix of methods, if you will. And that starting within DG Connect, our policy interventions have been technology laden, if you will, or focused. The key example is this state-of-the-art platform that will now enable modeling across scales and levels of human anatomy. In that, of course, we need to leverage, as mentioned just earlier, the power of novel advanced computational methods and capabilities. And all of this has to happen within the EU framework. So essentially, in compliance with EU values and rules regarding privacy, safety, security. Next slide, please. So here you see the four pillars of the initiative structure as we now have it. First of all, it is about the ecosystem engaging, mobilizing ecosystem actors in Europe. Then it is about research, and we wanted to foster the emergence of, we do call it foundational research, and it's not quite basic as such, but we wanted to move the needle forward when it comes to the research approaches for simulating human pathophysiology, and essentially move from the level where we simulate one organ to simulating more than one organs in combination. So one example that we have now seen is essentially modeling cardiac function with respiration, all the way to kidney function for a particular disease. In that regard, we launched 8 projects funded by Horizon Europe for a total funding envelope of 80 million euros. And more recently, through IHI, there has been one project funded in that context of the IHI JU to come up with innovative approaches to the treatment of stroke. That, of course, has to be supported by infrastructure, the development and deployment. We had the initial HPC Center of Excellence looking at multi-scale modeling of human pathophysiology, and on the basis of those, we're now moving forward with an advanced VHD platform for model integration and validation funded through the Digital Europe program. And we are making a start already with putting together the federated EU infrastructure for intensive care unit data. This is essentially a smaller funding envelope of 2 projects. And the key strategic aspects for making a start there is that in the ICU setting, the availability of data is very rich for reasons otherwise well known, of course, but it is a very good example of a healthcare setting where we could be starting building these more advanced digital representations of human health and disease. And of course, the key question after that is the uptake. So where does it actually happen and how it may happen? And of course, here, member states have a primary role when it comes to supporting, adopting innovations in their healthcare systems. At the same time, we're looking at the regulatory aspects, and there is one action funded by the Digital Europe program, the Uptake Incubator, to try and push some of these more advanced solutions closer to uptake. And of course, we do have, this all happens in the context of synergy with other EU initiatives and with a longer term view towards sustainability. Next slide, please. We have had the coordination and support action called EDITH, also known as the European Virtual Human Twin. And the key contributions have been to, first of all, very actively engage the ecosystem in the form of, firstly, signing a manifesto, a political statement of intent text that lists out key objectives for the European ecosystem in the development of the European version of the virtual human twin. And in the first, and secondly, assist the ecosystem, so help ecosystem actors to come up with a roadmap of what has to happen, all the activities necessary to move towards a more advanced and more coherent ecosystem as a basis from where these more advanced solutions can then be built. Next slide, please. The Virtual Human Twins Manifesto has been quite successful so far. We have had 115 signatories as of October this year. And in that, in this otherwise quite busy slide, you will probably see names that do not normally or usually feature in grants and procurement of the Union. This is to say that this manifesto process has had a wider appeal. And so we are indeed seeing participation from further afield and from the not well-known, not as well-known corners and pockets of the ecosystem. And of course, it does include representation from industry, academia, government, civil society, healthcare providers, professional, and importantly, patient organizations, and the high-performance computing centers, members of the Euro HPC joint undertaking. Next slide, please. This is a good example of the infrastructure that is now needed to essentially design, integrate, validate these more advanced VHD model solutions. And here, this is a public procurement run and led by our unit, and we're quite close to the point of making further announcements in this regard. But essentially, the benefits of this is to, and the aim really is to foster and enable truly European, truly collaborative, community-driven advanced research in virtual human twin-based solutions, all within a secure and privacy-preserving framework, and enable a wide participation and use from as many members of the ecosystem as possible in deploying their assets onto the platform and utilizing its advanced capabilities for collaborative work. Next slide, please. So the wider policy context of this is essentially the one of leveraging health data infrastructure for the development of advanced solutions, increasingly so for artificial intelligence-based solutions. And in that sense, we in Connect A6 and part of the European AI Office can now bring forward several infrastructures that are being built, have been built, starting with the 1+ million genomes initiative and the GDI project. Now, increasingly so, the Cancer Imaging Initiative and the infrastructure of UK is becoming prominent. We are now moving forward, as mentioned, with the VHT Initiative infrastructure program and the intensive care units data space for Europe has already made a start. And essentially, the overarching policy aim is to enable the availability and use of high-quality health data for artificial intelligence. I believe we have come to the end, Alina. If we could perhaps advance to the next slide. Many thanks. I see Christian is available. So, Alina, the floor is back to you. Thank you.
Okay, thank you, Kyriakos. Apologies for the connection problems that I have. Since I had to share my presentation time with Kyriakos, I will rush through my slides. So can I have the next slide, please? First of all, I would like to mention that there is no official definition of NAMs in the EU, but we can base on self, for example, definition from the European Medicine Agency or from a definition in the context of an action on NAMs for the European research area. For EMA, NAMs refer to innovative methods and strategies that aim to replace, reduce, or refine the use of animals in the testing of medicinal products, aligning with the 3Rs principles. These methods encompass a range of non-animal approaches, including simple and complex human cell-based assays, microphysiological systems, in chemical methods, in silico modeling, and other non-human or human biology-based test methods. In the context of the ERA action, NAMs refer to methods that do not involve live animals, such as in vitro, in chemical, or in silico approaches, as well as combinations of these. NAMs can complement or, in some instances, reduce or replace traditional animal research models for biomedical research and regulatory testing, as well as for the assessment of the safety, efficacy, and quality of products. However, in this particular example, we said that NAMs may still utilize animal-derived materials, such as, for instance, fetal calf serum in cell cultures. Can I have the next slide? I would like to present you the political and societal pressure to phase out animal testing in the EU. First of all, you might know that there is a ban on animal testing for cosmetics, which was fully implemented in 2013. There is also Directive 2010/63 on the protection of animals for scientific purposes, which sets the rules for handling animals for scientific purposes, but it also clearly states that the final objective is to phase out animal testing. We had two European citizen initiatives. The first one called Stop Vivisection in 2015, asking to to ban animal testing for scientific purposes, and the second one in 2023, which was called Safe Cruelty-Free Cosmetics. We had also two resolutions from the European Parliament. The first one calling on the global ban to end animal testing for cosmetics, so not only in Europe, but globally. And the second one to accelerate the transition to innovation without animals in research, regulatory testing, and education. And then finally, next year, the Commission will publish, in response to the European Citizen Initiative Safe Cruelty-Free Cosmetics, a roadmap to phase out animal testing for safety assessment of chemicals. Can I have the next slide? So this roadmap will provide the plan and schedule to accelerate the phasing out of animal testing, and it is applicable to all 15 pieces of EU chemical legislation that might lead to animal testing for chemical safety assessments. So, and this includes also the pharma. Can I have the next slide? So there are also actions from the European Commission to phase in NAMs in Europe. But first of all, there is the succession of framework program from FP5 to Horizon Europe, which dedicated more than 1.5 billion euro for more than 450 projects on NAM. More recently, in Horizon Europe, we see that more than half of NAM projects are actually projects on microphysical systems. And we see also that across the different framework programs, there is an increased number of bottom-up research and innovation NAM projects. So not only the top-down, the classical projects, collaborative projects, but there are more and more researchers and innovators which use and which develop and bring and try to bring to market NAM solutions. NAMs are included in the recent European Commission Life Science Strategies. Next year there will be also other calls for NAMs, for example, a 150 million euro course in Horizon Europe on NAMs for biomedical research and regulatory testing. NAMs might be also included in the forthcoming European Commission Biotech Act, and also in some of the revised EU legislations. It could be pharma, medical device regulation, the in vitro diagnostic, or REACH. And finally, we are launching European Research Area Action on NAMs for biomedical research and regulatory testing of medicinal products and medical devices. Can I have the next slide? So this action aims to coordinate and streamline the member states and also other stakeholders' actions on NAMs. And here all actors will be involved, not only the European Commission, but also relevant ministries, the regulatory agency, European Medicine Agency, research funders, academia, research institutes, infrastructure, pharma and medtech industry, CROs, journal editors, NGOs, citizens, and patients. So this is a holistic approach which involves all stages of biomedical research, from the basic discovery phase to application, implementation, and regulatory testing of medicinal products and medical devices. Can I get the next slide? So it is structured in 4 different working groups. The first one is on development of new NAMs, which could be taken up by regulators or industry, and also common EU infrastructures. The second working group is on validation, acceptance, qualification, and implementation of NAMs. The third one is on education and training, and the fourth one is on openness and awareness. This is a kind of pilot action for 3 years, starting really now at the end of December, and we would really encourage the current and future EIC project to participate, at least for the 2 first working groups on development of NAMs and validation. Can I get the next slide? So this is just to say that there is a momentum to phase in NAMs in the EU. The European Food Safety Agency has also published a roadmap for action on NAM in risk assessment. the European Medicine Agency has reactivated its 3 hours working party, which is tasked to prepare, review, and update guidelines and concept papers for NAMs, engage international cooperation, and liaise with pharma industry and NAM developers through different structures, among which the ITF Innovation Task Force, for which in the last 4 years, 13% of meeting requests were related to the 3 Rs, mainly microphysiological systems. EMA published a reflection paper on the current regulatory testing requirements for medicine products for human use and opportunities for implementation of the 3 Rs. And there are also, beside this, there are also sometimes bilateral initiatives from 2 member states, from example, Germany and Netherlands, which launched the ValNAM initiative, which aims to validate and implement NAMs in a regulatory context. Next slide. There are also, outside of the EU, there are also initiatives. There are bans on animal testing for cosmetics in several countries, and other countries have also published roadmaps to phase out or reduce animal testing. Next slide. And then finally, I would like to just quickly conclude with this, is that there are also major initiatives to phase in NAMs in other parts of the world, including in the US with the FDA Modernizations Act 2, which enabled drug registration without absolute requirement for the use of animal in safety toxicology assessment. There is a bill, which is the Modernization Act 3, which is not yet approved. The NIH has a big program which is called Complementary to develop, standardize, validate, and promote the use of NAMs. And finally, there is a foundation of NIH which recently launched the VQN network, which is a public-private validation qualification network. And with this, I would like to finish this presentation. Thank you.
Thank you very much, Christian. And Kyriakos for setting the policy context. Ushi, the floor is yours for presenting the challenge. Thank you.
Yes, thank you very much. And it's my pleasure. My name is Oshaya Simmons, or Ushi Simmons. I'm the Program Manager for Health and Biotechnology at the EIC. And after you've already heard about various initiatives and the policy context of new approach methodologies, I'm really happy and excited to walk you through the EIC Advanced Innovation Challenge on translating such disruptive NAMs into practice. It's been developed by myself together with my colleague Federica Zanca, who's responsible for medical imaging and AI in healthcare. And as you'll see, this challenge really tries to focus and bridge both biotechnology and medical technologies. If we move to the next slide. So where does the challenge come from? Well, as you've already been introduced to NAMs and the currently existing momentum around them, I don't want to dwell on this too long, but I do want to highlight that while there's been a lot of technical advances in developing different types of NAMs, be they in vitro, in chemico, in silico methods, and there's obviously a lot of potential for them to generate human relevant data. One major bottleneck that we've seen is really adoption. And there, of course, can be different contributing factors to this, including, for example, limited regulatory acceptance, potentially the lack of confidence amongst end users, and also maybe insufficient standardization and benchmarking. Next slide. And so really to overcome these barriers led to the creation of this challenge, which has the vision to move from a lab-based proof of concept to clinical and industrial adoption of NAMs. So very much in line with the overall concept of these advanced innovation challenges, and to accelerate the uptake of disruptive NAMs in biomedical research, safety, efficacy, and quality testing, to enable human relevant, ethical, and faster innovation in health. So if we move to the next slide. What this means is that the scope next slide. Yep, the scope of the challenge is to propose the further development of innovative and disruptive NAMs that address one or both of the following areas. So preclinical biomedical research or testing of medicinal products or medical technologies for safety, efficacy, or quality. So as you can see, the focus here is really on health. And if we move to the next slide, within health, however, you can also see that the type of NAMs and their applications can be very broad. So the scope is really quite wide. For example, in terms of biotech applications, the focus can be understanding and predicting human biology and drug development, such as it can be human organoids and MPS to model diseases and drug responses. In silico and AI-enhanced models to predict efficacy and toxicity, digital twins to simulate cellular or molecular processes, or mechanistic platforms for integrating multi-omics. Whereas in the medtech applications, the focus is on testing and validating medical technologies in human relevant systems, such as digital twins and virtual human simulations for device performance and clinical validation, AI-based predictive models for diagnostic accuracy and safety, 3D human tissue and organ on chip systems to assess implant compatibility or material response, or in silico systems to support regulatory grade submissions. So just emphasizing that these are only examples of that what is in scope, just to demonstrate really how broad we see this in terms of the types of technologies and the types of applications that can be included. Next slide. So how does the scope translate into practice? So as already was mentioned in the introduction of the whole session, the Advanced Innovation Challenges consist of 2 stages. So it's a 2-stage process, where the first stage in the work program 2026 focuses on feasibility and de-risking, whereas the second stage, which will be included in the work program 2027, will focus on scaling up and validation of the technology. And since stage 1 is the part that's included in this year's work program, I will go into a bit more detail on this part in the next slides. If we move to the next slide. So first of all, who can apply? This has already been discussed in the general introduction. It is an application for a single applicant who can be a startup, SME, or research performing organization, whereas larger companies are excluded. If we move to the next slide. And what is very important is that the applicants have a technology solution that already has proven viability at TRL 4. If you are familiar with the EIC work program, you will know that according to our work program, TRL 4 means technology validated in lab. But of course, how that is interpreted may very much depend on the exact type of solution that you're trying to develop, that you're developing. So it is important that you assess that depending on what type of NAM you are currently developing, how does this TRL translate to your solution? Here's a QR code to one of the references that we have in the work program to help, for example, translate this for different application areas. But I really encourage applicants to take a look at that to really make sure that where they are positioned on that TRL scale for the technology that they're developing. If we move to the next slide. So not only should applicants already have proven viability at TRL 4, it's also important to apply that you have letters of intent for at least one stakeholder. And this can be, for example, an industrial end user, but it could also be a regulatory body. And it is also important that you have access to the appropriate infrastructure that will then allow you to carry out the tasks in your proposal needed for steps 1 and 2. And maybe here I would just briefly mention that, of course, This can either be infrastructure that the applicant already has access to, for example, at their institution, but as you've heard already in the previous presentation, for example, for virtual human twins, a lot of infrastructure is also available at the European level, and there will be another presentation after this also showcasing some of those available through the JRC. If we move to the next slide. So what exactly is expected from stage 1? So the objective of the first stage of this NAMs call is to build trust on evidence. On one hand, by benchmarking the NAMs and also by exploring their feasibility and viability, and by focusing on the integration of the demand side, both with regards to possible end users and also the required regulatory path. Accordingly, the objectives of this first stage of the call is to map the regulatory, clinical, industrial needs, to engage with the regulatory authorities, notified bodies and industry as needed, develop performance assessment methodology, conduct small-scale feasibility studies, perform initial benchmarking, and to address ethical data governance and scalability aspects, ultimately generating the data that is needed to prepare a strong proposal for stage 2. If we move to the next slide. And so to be able to apply for stage 2, at the end of stage 1, applicants must demonstrate really impact and readiness of their solutions. So through the work that they carried out, they must have evidence for technical, commercial, regulatory viability of their NAM, including a clear commitment from industrial end users and a defined regulatory plan to move their solution to the market. Next slide. Okay, since we already mentioned that the results from stage 1 will then be further moved towards stage 2, where the goal is to develop the NAM further and importantly, to test them in real-world settings. I also just want to provide an outlook here, what will then be sort of in stage 2. Where activities may include making use of the performance assessment methodology developed in stage 1 to then carry out benchmarking compared to animal studies or human trials, or to demonstrate use in product testing. Or another example would be to build on the assessment of regulatory needs in stage 1 to really develop regulatory grade packages in stage 2. So next slide. So ultimately, considering both stage 1 and stage 2, this challenge will collectively really accelerate the validation and adoption of disruptive NAMs, enable regulatory innovation and evidence-based guidelines. It will strengthen the competitiveness of the European health sector and provide sort of toolkits for harmonized NAM-based assessments, and provide access to more human relevant testing. Next slide. And in the general introduction, again, you already got a detailed explanation of what makes a strong proposal. So here I would just focus on sort of the health relevant aspects. So one is that these NAMs really have a clear human relevance and breakthrough nature as a scientific novelty, that there is end user and regulatory engagement from the start. That's why we ask for those letters of intent to really build that trust with the end users, that there is a realistic path to validation and standardization where possible, that there is an attention to the ethical and data governance aspect, and that there is really a strong sort of interdisciplinary partnership. So of course, it's a single applicant who applies, but you need to have access to the right infrastructures, to the right partners, subcontractors who can help really bring this project to fruition that you're proposing. And if we move to the next slide. I will go just very briefly through this just to emphasize that please keep in mind that the Advanced Innovation Challenge, you're now applying for the first stage, but ultimately to see it as part of a bigger process where there will be a second stage following this, but also really hands-on support, for example, by having a stakeholder workshop during that first stage to help facilitate some of those goals and the vision of the overall call. And with that, I would end. And I think hand over to the colleague from the JRC.
Thank you very much, Ushi. Indeed, and now I would like to invite Milena Menekotzi from JRC to join us and present the JRC activities.
Yes, hello to everybody. Will you please move to the next slide? So in this last presentation of the session, I would like to give you an overview, a flavor of the type of activity and resources that we could provide you with from our side. But before going there, who we are, what we do. So the European Commission Joint Research Centre, also known as JRC, provide independent evidence-based knowledge and science to support different types of policies. So this could mean sometimes to anticipate a certain trend, to try to integrate a different type of data, for example, try to connect different stakeholders, and ultimately what we are trying to do is to have a positive impact on the society. So in each slide I put a QR code, so feel free to scan it to get more information in addition to what I could tell you today. Next, please. So I told you that we work towards policy, and as you did hear already from the previous presenters, biotechnology is very high up into the political agenda. So biotechnology is therefore a very important and strategic technology. This is the reason why this year in the group I'm working at, we have done a market analysis to evaluate one specific area of biotechnology, in vitro biotechnology, so all the biotechnology around cell system and so on, how this market is performing. And what we notice is that at the European level, at the UN level, although EU is pretty good and sometimes is playing a leader role in developing and innovating, unfortunately EU is struggling to convert scientific discovery into business creation. This is why we could do and we should do better. And we as a JRC, we could be the enabler. We could help you throughout the phase of your value chain to try to put your market from the laboratory to really the market, and try to help you out with the different resources that we have available. Next, please. And just to tell you a bit more about what we do, I'm working at the EU Reference Laboratory for Alternative to Animal Testing, also known as ECVAM. So we have done for many years validation of alternative methods for chemical safety assessment. We also have a laboratory where we perform research and development of alternative methods, and we are working on the dissemination of the promotion of the 3Rs. So our work is basically mandated by the directive 2010-63 that was mentioned earlier on the protection of animal use for scientific purposes. Next, please. And if you wanted to know more on the type of activity that we do and the resources that we have available, please look into our webpage. We also have a newsletter, it's a monthly newsletter, so we really encourage you to subscribe to the newsletter just to see what we are up to and what we are planning to do. Next. And now just to show to you some of the resources that we did already develop. This is in these slides you see a review of non-animal models used in biomedical research. So in this work we look specifically at some disease area. We look at 8 of these disease area that are including some type of cancer, autoimmune disease, cardiovascular diseases, and we evaluated what type of non-animal method are already present in publication. So this could be extremely important to understand what is the current status, who could be your competitor, for example, or who are the people that you could collaborate with. Next. And following up from this initiative, we have recently launched BIMO, a biomedical model hub. What it is, this is the first public knowledge database of human biology-based models. It's based on machine learning and is retrieving a literature that is really based on human biology models. So it's looking into PubMed, and based on the information that are present on the title and abstract, then putting together all these publications and then categorizing them in a way that is very easy to search, for example, based on organ, disease, and models. Again, this is a very useful tool for benchmarking your innovation and your project. Next, please. What we really encourage you to do since really the beginning of your project is to apply standards. Only if you apply standards, you can make your research more reproducible. And in this context, we have published a series of different documents. You see some of them in here. So there is the GIVIMP, the OECD guidance document on good in vitro method practices that are giving to you really step-by-step information of what is needed for your development and establishment of your in vitro method practices. We have also organized some workshops that then led to collaboration and the setting up of a roadmap, for example, for the standardization of organ-on-chip technologies. So this was together with the European Organ-on-Chip Society, and will ended up in the publication of an ISO on microphysiological system and organ-on-chip. We also publish, we have internal expertise on different emerging technologies, and we did publish on the importance of setting up best practices and apply standards. This is true, for example, for image-based in vitro method, for transcriptomics and proteomics, and for ensuring the reproducibility of stem cell research. Next, please. In case the method that you are trying to develop have a very clear regulatory use, in that case, this method could be submitted as a validation. This means that you could reach out to our group already at the early stages, for example, to get specific advice that could be scientific, technical, or also regulatory advice that could help you moving your project through toward the cycle that I presented in here. So if then this regulatory use is very clear, you could submit the information in a test submission template that will be evaluated internally. And in case you want to perform a validation, we have set it up a network of laboratory for the validation of alternative methods. These are 33 laboratories in Europe that could help you in the validation of your method, meaning in really performing a reproducibility study where you evaluate the reliability and the relevance of the method for a specific defined purposes. We also have a tracking system for alternative method toward regulatory acceptance. This is an online page that is enabling you to see all the different types of methods that we have received so far, at which stage they are, how the submission look like, and for example, what type of recommendation we have given in the past. Next, please. In the case instead of developing novel methodologies for medicine development, the agency that you should refer to is the EMA, the European Medical Agency. We have been collaborating a lot with EMA in the past years, and in here I put together some of the initiatives that they recently established. In this case, we are not talking anymore of a validation of the method, but we are talking on the qualification of the specific methodology that you are developing. And we are sitting up with EMA in some of the innovation task force briefing meeting together with consortia, and I really encourage you to use this as a way of have an early dialogue with the EMA in order then to address some specific regulatory, technical, and scientific concern. Next, please. The last thing that I want to share with you is that the doors of our laboratory are open. This is the high throughput testing laboratory for in vitro methods. In here we have expertise that are going from high throughput testing down to organ on chip, and therefore reach out in case you want to use our instrumentation or our expertise from the laboratory. And the very last slides. If you want to know more of all the activity that we perform at the ECVAM laboratory and group, we publish every year a status report, and the 2025 is going to be published very soon, so please watch this space. Thank you very much for listening, and that's it from my side.
Thank you very much, Milena, and to all speakers for this session. So we will go now through the questions that we have received in the Slido. So zebrafish larvae are considered in vitro by the EU law on animal experimentation. Are they considered as a NAM for this call of proposal?
Yeah, I would take this maybe already together with the next question as well. Apologies. Because I think I would encourage applicants to look in detail at the scope section of the call description, from where I think it's much easier to understand what is and is not in scope. So, for example, zebrafish larvae are not.
Thank you very much, Ushi. And digital twin was quite addressed in the presentations before. So we will take the next question. At what TRL should may the project start? The EIC Work Program 2026 states that TRL 4 has to be reached. Does this mean that the projects can at TRL 4 and also at TRL 5 or 6?
Yeah, I guess from a purely sort of TRL level perspective, indeed, it has to be at TRL 4. However, when you look at what the sort of objectives of the first and the second stage is, I think if it is too high a TRL, such as TRL 6, I'm not sure that those objectives really make sense if someone is already at that level of sort of technical advancement. So I think TRL 4 can be completed, but beyond that, I'm not sure it would be a good fit from sort of the content perspective.
Thank you. Next question. Is the challenge dedicated particularly to replace reduced animal testing or broader new methods in preclinical testing as well? If that is the case, would organ on chips platform that address used cases indications that do not normally involve animals in preclinical trials be eligible?
Yeah, indeed, the challenge does not specifically require that it is for the replacement of animals, for example. So, and if you look at, for example, some of the sort of next step, stage 2, you can see that the benchmarking doesn't necessarily has to happen against an animal model. It can always also be in the context of clinical testing. So that is not a requirement.
Thank you, Ushi. What can a regulatory agency be? EMA itself, or can it be an agency company with expertise in regulatory pathways?
Yeah, for this, I would encourage applicants to really think about the ultimate goal of the challenge, which is, of course, to make sure that there is regulatory readiness when developing the project. In the last presentation, we also heard about EMA qualification. So it is to set up and establish a clear regulatory path. So while, of course, bringing in regulatory experts to help determine that path is one critical, or can be a critical step, ultimately, what will be needed is that you identify who would be responsible for regulation and can or how do you involve them early on in your product development to make sure that you can sort of bring your product through regulatory approval efficiently.
Thank you, Ushi. Next question. Services provided by JRC come under a collaboration agreement. Are they free of charge for applicants?
I would maybe propose
Milena?
that Milena answers, yes.
Yes, they are. I was trying to switch on the camera. Yeah, there is no free of charge.
Okay, thank you. Does the AIC call support only NAMs and biological products, or also enabling platforms such as the advanced bioprinting and robotic systems that form the foundation for scalable, highly reproducible manufacturing of 3D tissue models, organoids, and chips?
Yeah, I would again encourage applicants to really look at what is in scope, to position the technology that they're developing to see whether that fits with the described scope of the challenge.
Are preclinical studies for diagnostic tools in scope? How about early stage clinical trials?
Yeah, the same as above. So again, take a look at the scope, what exactly is covered, both in terms of methods and in terms of health application.
Thank you. Is there a specific focus on the tissue organ type, or are platform technologies preferable?
No, it's not specified if there's a specific organ or tissue type that needs to be addressed. Ultimately, I think what is important is, again, that end user involvement. What is it that they are looking for to make sure that you have sort of a market-proof product that you are developing?
Thank you, Ushi. Could analytical tools such as sensors also be eligible for the NAMS challenge?
Again, I think there are almost endless permutations in terms of technology and in terms of sort of application areas. So rather than going through one by one, applicants should look at the scope to understand whether or not their technology and their application area is a fit.
Indeed. In regards to AI NAMs and the impact on the upcoming AI Act, what kind of support can we expect from AIC to support compliance?
Yeah, so what you can expect, and I think that was also on one of our slides that was presented, that of course there is hands-on management in the Advanced Innovation Challenge, meaning amongst others that there will be, for example, a stakeholder workshop included in the first stage. So program managers are of course actively involved in providing support.
Next question. If the stage 1 applicant has access to critical infrastructure from a third party, an academic partner, would this be regarded as sufficient for stage 1 application, especially if considering that the academic partner is intended to be part of the stage 2 consortium?
Yeah, so again, I think for us, what is important is that you can carry out the work that you propose, and that you have the right partners on board to be able to carry that out. And how you put that in your proposal is up to applicants, sort of how they demonstrate that.
Thank you. The next question. Further development seems incremental. Can you please comment on the innovation expected?
Yeah, so here the Advanced Innovation Challenges really bridge that part of not only driving the technology forward, so moving along the TRL levels, but really to build that trust with the end users. So I think the innovation, of course, is you have a core deep tech technology that you are developing and that you're moving this along the TRL levels. So there's further development. But at the same time, the other critical aspect in the Advanced Innovation Challenges is, of course, sort of that building the trust on the regulatory side and with the end users.
Thank you. Our next question is, if the goal of the proposal is to validate a new biomarker for a complex disease, would the most relevant stakeholder for writing the LOL be a hospital doing further diagnosis based on the new biomarker, or a bigger pharma company whom will use the biomarker as part of the pipeline development?
Yeah, so in this case, I would refer, I think, quite strictly to the challenge text, which states that the letter of intent should be from an industrial end user. So if you can place a clinical partner as an industrial end user, I'm not sure that's true, then it could be a clinical user, but most likely it would have to be an industry partner or an industrial end user.
The next question that we see, the technology that we have in TRL4 is multifaceted and can be used in different NAMs or NAM objectives. Should we then apply with one project or with several?
So I would say that is for the applicant to decide, thinking about what sums of money you get through this challenge and what is feasible to carry out with that work for driving your innovation towards the market in a reasonable manner.
Okay, our next question, I think it was previously answered by you, Ushi, and we can take one more question. The last question that we can take, can you link Health Digital Twin EU initiatives and the upcoming open call for EDI? Are they expected to be integrated? I think from one of the colleagues from the DGs.
Yeah, this would be a question for Kyriakos.
Yeah.
Yes, thank you. So the upcoming open call for the European Digital Innovation Hubs is essentially for a variety of purposes. So if we would have, in the context always of the call as elaborated, communicated, published by colleagues, if a plausible link could be made whereby an EDI would somehow be used in the context of the Virtual Human Twins initiative to develop a NAM as per the scope explained, then this would make sense from a policy viewpoint, and I would defer to the colleagues as to whether that would also be welcome vis-a-vis the scope and spirit of the call. But essentially, from a policy viewpoint, if indeed the link would be plausible, it would be welcome.
Thank you, Kyriakos. Unfortunately, We have to stop here because our timing is up. We will answer to the remaining question in the frequently asked question on the EAC website. Please remember to respond to our satisfaction survey and help us improve. Anne-Marie, would you like to pass the final remarks?
Okay, thank you, Alina. So I also want to thank all the participants for listening and for the many questions that you have asked. I hope you have had a good explanation of what we are looking for. There was a lot of information in all the presentations, so I can understand that this first viewing is not enough to grasp everything, but we have recorded everything. So if you want to write a proposal for the Advanced Innovation Challenges, please re-watch the presentation to fully understand what we are looking for. The call will open on the 3rd of December, so that is really soon. It will also close fairly soon on, now I say it by heart, 26th of February. Yeah? And yes, so if you want to do this, please don't wait too long, because of course it will take some time to prepare your proposal. I also want to thank all the speakers, all the colleagues from the different DGs, and then also my colleagues, Alina for moderating and organizing the session together with Xenia, and then Heidi and Ushi for presenting their challenges. So good luck. And yeah, if you have further questions, please ask them also to your national contact point. The national contact point will contact us if needed, and we will elaborate the frequently asked question also with the questions that you have answered, so that that remains visible. Thank you very much.
Thank you. Have a nice evening.